Okay, can you all see? Because I can't see this now. Okay, here it is. Yay. Okay, these are objectives. The gut ties into a lot of, plays a big role into our immune system. I say about 95, I've read different things, 75 to 90% of our immune function is actually stimulated or has some sort of role. The gut plays some sort of role. So that's a lot of, good morning. That's a lot of immune function that is very dependent on our microbes and our GI tract being healthy. Also, neurotransmitters. Neurotransmitters are actually a broad spectrum catch-all phrase or term for things like the happy juice, serotonin, dopamine, norepinephrine, all of those things that make us feel good, feel excited, feel sad, whatever. But the neurotransmitters, they say about the same amount, 75 to 95% of our neurotransmitters are actually produced, stimulated, or have a role that the gut plays for those neurotransmitters. So the gut plays a role for the neurotransmitters quite a lot. Hormones, also really big deal. So GI tract is important in helping regulate, metabolize, and detox and help get rid of hormones. And hormones in the layman's terms we always think of estrogen and testosterone, but actually there's a lot of different hormones, just something that stimulates a reaction downstream typically. And then I'm actually going to talk a little bit about some new information about COVID and the GI tract. So just for fun, I'm going to throw that in at the end. This is a good picture. It's really complicated and it looks a little busy, but the idea is you have neurotransmitters, you have inflammation, you have all kinds of stuff down in the GI tract. So down in the bottom, down here where it says short chain fatty acids or CFA or SCFA, sorry. And then these little bug things in the brown area, that's going to be inside the bowel. The blue little things with the purple dots in the middle, those are the cells that line the GI tract. And there's actually a couple different layers. And then there's a nice slimy layer that goes on top of that as well. But the idea here is it's showing how there's some cytokines in tumor necrosis factor alpha. There's ILB1, there's IL6. Those are inflammatory or immune chemicals. And so you can see how that's related. You can see there's also a relationship between GABA, which is really calming to us, makes us feel really chill. Tryptophan, so you're starting to see the neurotransmitter production there and how it relates. And then you can see how it all feeds back. And then there's a nice feedback loop from the vagus nerve that travels from the base of the brain all the way through down to the GI tract, and it helps regulate our bowels. It's actually really important because if you were running from the bear or stayed in a stress state, you don't want to have to go poopy all the time. So it stops that. So the vagus nerve innervates, it helps regulate that fight or flight input. So some of us is stay in fight or fight for a long time, or we have a stressful presentation to give and the technology is not working. Well, that slows the bowels down. But it's a good thing because I don't want to have to go to the bathroom right in the middle of the presentation. On the other hand, some people have a lot of vagal nerve input and they'll get some chemicals released. And right before a presentation, they have to run to the bathroom. So that's that nervous intervention. So it all ties together, and that's what we're talking about today. I'm going to do this by giving you a couple case examples because I feel like I learn better when I can actually relate it to someone or something. So my two patients that I'm presenting, one is male, one is female, and they both presented with different problems. One was strictly autoimmune and high blood pressure. That was the female, but she did have an autoimmune she had rheumatoid arthritis as her autoimmune disorder. And then the male, he presented with actual GI problems. So he had some bloating and some gas, and he felt like his GI tract just wasn't great. He was always complaining of, constipation one time and then diarrhea another time. So they call that mixed IBS. Irritable bowel syndrome mixed. So it's both constipation, diarrhea. He also was complaining that he's only 37. He's starting to really have to write down things. He's not remembering things as well. And he's really struggled since about the age of 16 with some anxiety and depression. So those are the two cases that we're going to talk about. I'm going to tie it in and show you how the gut is related to both of them. So as I was talking to both of them, taking their full history, I always ask about GI history. And one of the funny things is I was asking the female about her GI history, and she's thinking, I'm here for my arthritis. I don't know why you're asking me about my pooping, but it's really important because sometimes bugs that grow in the gut can be directly related to some of our autoimmune disorders. We actually have a section on that test that Tim's going to talk about today that actually is labeled potential autoimmune triggers. So there's different bacterium that can cause a reaction that cause your autoimmune stuff to be worse, that are hanging out and living in their GI tract. So she thought it was strange that I was really worried about her bowels, but it really does tie in. So our goals for both of them at the end was really just to have regular good bowel movements. That is a full daily evacuation, hopefully stop their bloating, better digestion, good sleep, and improving his mood overall and memory. So that's our goal for him. For her, my goal actually was to improve her GI integrity. So I wanted her cells that line her GI tract to be really healthy so they could help modulate and properly regulate her immune function so her rheumatoid arthritis would calm down. I also wanted to make sure that there wasn't any bacteria like we just talked about that was causing some problems as well. We want to calm inflammation, and then you're going to find out, because she has high blood pressure in her case, she also had elevated heavy metals. So that'll tie into our blood pressure, and we'll talk a little bit about that. So what did we do for the young man? We actually did a comprehensive stool test, which we're going to talk about. And we also did what they call a small intestinal bacterial overgrowth breath test, SIBO breath test. So sometimes you can have belly bloat that's right in the middle, and that's I should say it's not more often. It's more typical of a small bowel presentation as opposed to a large bowel presentation. And when you do a stool test, you're actually testing the large bowel. You're not testing the small bowel, and that gets very confusing for people sometimes. Most of our immune modulation actually is in the small intestine. So there's things I can look for on that test to give me hints whether or not that small bowel is looking good, but it's still really important to keep those two in mind. We also looked a little bit at his genomics because that'll play a role here in his case. I did some basic labs. Some people ask me why I check MMA. If you're looking for a B12 deficiency, fun fact, if you don't have good bacteria, the probiotic bacteria, especially the Bifidobacter species, you can have trouble producing B12 or modulating B12. And if you have an MTHFR or any kind of methylation mutation, you have trouble converting it. So when you check B12, really you should check B12 in the blood, but you should also check that MMA on there on his note. So I always say that because people don't realize that, to find out really what's going on inside the cells, how well you methylate it. We checked a few other basic labs. Zinc is very much tied to mood and anxiety. It helps convert magnesium and zinc are two big players with B6 producing serotonin and also helping us metabolize the fight or flight hormones, norepinephrine and epinephrine and dopamine. So we did a few other tests for him, and then we're going to keep moving along. I do not typically test a full nutrient panel with someone that I have a high suspicion for bad GI issues, because if they're malabsorbing, if they don't have good digestion, there's really no sense in spending big bucks on a vitamin panel and putting them on a whole bunch of vitamins or something that you think is going to help rebuild them to replace deficiencies if they're not absorbing it well anyway. So we start with the GI tract if it's necessary, and then we move forward. So we did a few nutrient replacements. You can see the lab results here. That middle section is the lab results from the GI test. And so these are the important things that I found. He did do the small bowel breath test. So when he drank some sweet stuff and then he pushed his breath into this bag, what it was measuring is methane and also hydrogen. For him, his methane gas was really high at a period on his test, which actually made a positive test for small intestinal bacterial overgrowth. Makes him belly bloat right in the middle, usually always after he eats, sometimes even after they just drink water or any tea or anything. It just really sets the I always say the bugs in the gut are having a party. So he's got belly party going on, big bloating and so forth. So when we did that, he was positive, and we're going to treat that with some antibiotics. You can treat it with herbals, but it doesn't seem to be as effective if you have severe SIBO. Then he also noted that we had low butyrate. I'm going to show you a slide in here that tells you the good bacteria will produce butyrate. Butyrate is a metabolic byproduct from good bacteria. And if they don't produce enough butyrate, we have trouble with asthma. We can have trouble with mood disorders. So we need to feed our gut bugs, and we need to have proper levels of good bacteria probiotics so that they can produce all of these things to keep us happy and healthy. And so that was also noted for him. He had a positive baking soda test. Sometimes I'll have people do a baking soda test. It's actually a really easy old-fashioned way of checking to see if someone is producing too much acid or too little acid. And so we always take antacids when we have acid reflux, thinking that it's burning, so we must be producing too much acid. But sometimes it's actually because you're producing too little. The food sits in there a long, long, long time. It's sitting and sitting and sitting. The body's trying to digest it. It's trying to get it to a acid pH in your stomach so it can get out of the stomach and go into the small bowel. And so if you are not producing enough acid, you have that tendency to have reflux, because after a while it's just sitting there and it's digesting lots more acid, lots more acid, lots more. And we have the acid reflux as a result of too little. And he was one of those too little people. So he said to me, when I took Pepsid over the counter, it worked for a couple of days, but then it really didn't help anymore. I'm still having that reflux feeling, and the food just sits in my stomach. So he gave me clues in his history as well. He had a really high gluten antibody, which means that he probably is a gluten intolerant patient. So we got him off of that as well. And we'll talk a little bit more about that. Those are some of the genetic markers, and I'll kind of come back and reference those in a little bit. BDNF is really important because we don't produce butyrate. We don't have the fertilizer for our brain. And so then we start having cognitive impairment or memory decline sometimes. Are we not hearing me very well? Oh, I'm looking. Oh, is this where you are? Oh, hi, everybody. I'm sorry. This is what happens when you have multiple computers. Okay, so I'm looking at my screen, not you guys. Sorry about that. I'll turn this way. Thank you, Steve. Okay, so anyway, on to the results for the nice young lady. She looks a little bit like a Marge spinoff. Good morning, everyone. So good morning, Jessica. Her stool test was really interesting. She actually had two potential autoimmune triggers, Klebsiella pneumonia, and we always think, oh, well, that causes pneumonia, and it can also cause, respiratory issues like bronchitis, but it also has been tied in the literature to be correlated with rheumatoid arthritis. So at high levels, she's growing at a gut bug, that could cause her rheumatoid arthritis, her joint pain to be worse. So we will treat that and get rid of that. And then she also grew out Proteus, which is another autoimmune trigger. So we'll get rid of that. It also can tie to a lot of urinary tract infections. And you can have bugs living in the GI tract at high quantities. And as long as the immune system's doing what it's supposed to be doing, and the integrity of your bladder wall and your bowel wall is healthy, then okay, fine. But if your integrity of your bladder wall or your bowel wall together get thinner, or they're not doing what they're supposed to be doing, they'll have some cross communication, and that bacteria can cause some urinary tract infections, but living predominantly in the bowel. So you can have reoccurrent UTIs. So you always want to make sure the gut looks good in those situations. We did some nutritional testing for her, and her lead level came back really high, and that's a red blood cell lead level, and she has high blood pressure history. And we know in the literature that lead is tied to high blood pressure. So we will work on that, but we want to make sure she has a very healthy bowel and good full bowel evacuations before you do any heavy metal detox. It's one of your primary elimination organs. And if that's not working well, it likes to displace elsewhere. And that can cause problems, because lead loves bone and fat, and it'll go to places when you try to start pulling out if you can't get rid of it quickly. So we don't want to mess things up. Genetically speaking, she has trouble with some glutathione and so forth. So we do some genomics on some people, but not everybody. But it does give me more information. It helps me direct their care. Treatment for her, I gave her an antibiotic, and a lot of people say, oh my gosh, why are you giving an antibiotic whenever you're trying to get the good bugs to grow? Well, it is true. Antibiotic means that it takes out all bacteria, whether good or bad. It doesn't favor one or the other, but you want to restore homeostasis, restore balance in a GI tract. And if you have what's called dysbiosis, or too much of a bunch of bacteria that are growing in there that shouldn't be in there, it's kind of like, I always give the analogy of a gang. So you have inner city, a beautiful little neighborhood that was in the middle of a city, and it was doing great. And then all of a sudden, in moves all the bad guys. So in come all these bacteria that we don't want. They start taking over. They're like the gang that takes over. They run out all the little good guys. So now your probiotics can't flourish and live very well. And now you've got an inner city gang area that used to be a very healthy, happy, balanced neighborhood. Well, in her case, her neighborhood was very dysbiotic, imbalanced. And so we want to get rid of the bad guys, let the good guys repopulate if we can, and at least keep a better balance. So we're trying to get rid of her gang members in her tummy, so to speak. Heavy metal, we will talk about doing that later, and we're going to talk about heavy metals and how they're related to our health at another educational series. So hang on to that. But sauna is very helpful for a little bit of gentle heavy metal detox. Prebiotic foods, I think Tim's going to talk a little bit about this tonight, but the idea here is you want to feed the good bugs in the bowel. You have to put fertilizer in your garden. You have to nurture the soil. It's the same in your GI tract. Our little microbes, our probiotics, love good, healthy, fibrous food. And these are really good prebiotic foods. I always remember, artichokes being on the list, garlic, onions. And some people that have really bad small intestinal bacterial overgrowth can't eat a lot of these foods at first because it actually feeds the good bacteria. But then there's almost like it's a war going on. You got the bad and the good, and they're fighting, and they belly bloat, and they're miserable. So, a lot of people come in and say, well, I can't eat those because it really makes me sick. You can after we get control over what's going on in your stomach and it gets better balanced. And then we do need this stuff to repopulate and rebuild the good gut flora. So those are prebiotic foods. So I was talking earlier about how the GI tract could be related to our mood and our anxiety and that presentation. And this is just another visualization so that you don't think I'm just spouting off randomness here, but it's really studied quite well. If you get a lot of inflammation in general, then you're going to cause inflammation in the brain as well. And that can cause some anxiety and depression, and vice versa. If your bowel lining isn't doing what they're supposed to be doing, or they're trying to fight some inflammatory war, then you're not going to modulate your neurotransmitters as well. So there's a big tie between those two. A lot of people will have irritable bowel syndrome for a while before they develop anxiety. And the worse their GI tract gets, the worse their mood is getting, or their psychological state's getting. So there is a direct tie to that. See it all the time. As they get better, bowel gets better, they get better. And these are just journals so that you know that we're got some proper references out there. This is serotonin and those little cells that line the gut lining. And so it's just showing you how it's a nice tie to neurons that helps the bowels move. Serotonin is really important for keeping bowels moving, not just for making us happy and calm. So sometimes if we have trouble with constipation, sometimes in medicine, we can even use fluoxetine or Prozac or even Zoloft or any of the SSRIs because it helps modulate serotonin. And so they've noticed that sometimes the treatment for irritable bowel syndrome, if you're giving a pill for the ill, if you're going to write a script for the problem the patient presents with, sometimes they'll use antidepressants. And it's not because your bowel's depressed, it's because it helps with motility. But if you really want to get to the root cause and fix the problem, you all are learning that there's way more to this picture. These are some of the journals related to gut microbial balance and depression, as well as to mental health states. And then we talked a little bit about butyrate. I just wanted to drive home that it's really, really important that we have good butyrate levels because it shows us that there's good, healthy gut bugs. It helps with our fertilizing our neurons in our brain, and it also helps with modulating and regulating mucosal lining response, especially in asthmatics. Some more information about the whole tie between gluten and the bowel, and also gluten in the brain. So everybody thinks that when they come here, they're going to automatically be taken off gluten. It's not the case, but I do find in a large portion of our patient population that when you eat gluten, you're having some kind of immune response. And if I'm trying to make you well for a short period of time, I might take that away because when we eat gluten, 100% of the human population, when we eat gluten, it stimulates an increase in zonulin. Down there in the yellow, you'll see the word zonulin. Zonulin holds our tight junctions together. So in this picture, you can see two cells that are lining the gut lining. And right in the middle where the little, looks like little fingers are sticking out, there's some red. That's where your tight junctions are. Those lines between each of these cells are tight junctions. So it holds the cells really, really tight so that only tiny microns of things can get in and out of the bowel and into the bloodstream. Well, if you eat gluten, all of us, we have a loosening of those tight junctions, whether it's minutes, hours, days, it depends on your reaction to that. And some people that have celiac, for example, it could be days where it stays open. Well, a lot of things can get out into the bloodstream and cause an immune reaction that it shouldn't shouldn't otherwise cause. So we can see that for most everybody, a short period of no gluten could actually be really helpful. We also know that they have, or sorry, let me go back. They have also found tight junctions that are zonulin regulated in the brain. So now they know that it can increase blood-brain barrier permeability. So if you're having brain fog, if you're having memory issues, you really need to limit or avoid gluten, in my opinion, because we know there's a direct tie, which means you can increase inflammation in the brain. And I don't know about you guys, but I don't need any inflammation in the brain. So for this young man, we followed up with him and he was doing really well. He ended up using digestive enzymes because his pancreatic elastase that was noted on the test, we'll talk about that tonight with Tim, was actually really low. So he wasn't breaking down his food very well. He also was under a lot of stress for a long period of time. So his hydrochloric acid production from his parietal cells was really low as well. So that caused him to not break down his food as much. And so then he's got large undigested food particles feeding the wrong kind of gut bugs and causing reflux. So we took with just digestive enzymes and adding some betaine in it, which stimulates HCl production, acid production in your tummy. He's feeling better, digesting better. He's less gassy. His wife's happier about that. And he's not bloated as much. His mood started getting better, probably because we upped his vitamin D and B12, but also because his GI tract was calming down. So inflammation in general was getting better. So over time, he's definitely going to notice, as he stays consistent with the pattern, 3, 6, 9, 12 months, you'll notice it's cumulative. It keeps getting better and better and better. So it's sad when people stop. They feel good in 3, 4 months, and then they stop and go back to their bad behavior. They stop taking their supplements. They really hadn't finished the cycle. So I always tell people it's a long haul, but it's amazing because it keeps getting better and better and better if things are going correctly. If things aren't, you got to fine tune and readjust. This is just talking about antibiotics, prebiotics, how bacteria in the gut, how they affect the joints. It's just showing that when you've got a gut bug in the bowel and it crosses and it triggers immune modulatory responses, you can raise things that are causing inflammation. And then the body will take that stranger danger, whatever it is, and it sticks it into tissues or joints or whatever. And so every time I expose someone to, say, dairy or to something that bothers them, a gut, a bacteria that's still there, every time the body sees it or recognizes that bacteria, it's going to go attack the joints or the whatever space that they put the original antigen, the original nuisance. So they hide it away at first, and then they see it again. They go, oh, stranger danger. And then the joints flare every time they have dairy or they have their Klebsiella pneumonia raises. So it's just showing the tie between immune function and the gut. Keep going here for time. We talked a little bit about lead. There is a direct correlation between lead and blood pressure. So we'll talk about that when we talk about heavy metals. I'm going to circle back to that. There is a direct gut relationship with heavy metals, especially if you have this funny mutation. So it's harder for you to clear heavy metals. It creates a huge inflammatory response. And over time, you can get accumulation in the fat tissue. So that's what we're talking about there. We'll talk more when we talk about heavy metals. Sauna is a very nice way to help modulate the immune system, as it lowers inflammatory cytokines. It also lowers cortisol, but it also is a helper for clearing heavy metals. And that's what I was using the picture here. So we're going to tie it back into the same case next time when we do heavy metals. 1 year follow-up for this young lady. She's doing better. She's not on a biologic anymore, but she is having to use steroids occasionally. And usually it's because she eats the wrong thing for a period of time and her joints get flared up. And so she'll take a little low-dose steroid to knock that down, and then she gets back on track. But overall, she's actually doing really well. Blood pressure better. I wanted to quickly show this. So in April 26th of 2021, there was an article that was put out where they were hypothesizing, why is it people are having severe COVID neurological symptoms? So when we say neuro-COVID, we think headaches, mood changes, brain fog, losing taste and smell. And so they thought it was because COVID was getting into the cerebral spinal fluid and then getting into the brain and causing some effects that way. And they postulated that may be the case. But when they tested a whole bunch of people's fluid from the spinal column, there wasn't hardly any COVID in parts of COVID or any suggestion that COVID was there. So they're like, wonder what's going on. Well, what they found out was, so COVID can survive the gut acid, and it also makes it worse if it's hypochlorhydric. So we talked about having that gentleman having low acid in his tummy. It can survive that. So it gets into the bowel. Some people will have GI problems with COVID because it can get through the ACE receptors and so forth. And then they said, well, gosh darn, once it gets into the bowel, then it can get in the bloodstream. It's getting into the bloodstream, and it's circulating, but how's it getting across the blood-brain barrier? Because that barrier is like Fort Knox. You're not getting across it unless you're allowed entry. And they're like, well, how's that happening? And what they realized was, oh my gosh, COVID might be like cholera, or it might be like gluten, and it opens those tight junctions. And sure enough, they have shown that COVID can lax the tight junctions in the bowel, but also relax the tight junctions in the brain by stimulating zonulin. So fun fact for today, if you have COVID or you think you're getting it or you've just been exposed, cut out all gluten in your diet. Do not take it in, because it's just going to increase that permeability and increases your chances for having really severe COVID neurosymptoms. So that's my fun fact for today. I think we have a couple minutes. I'm going to go ahead and see if anybody has any questions. I know I sped through that really fast and there's a lot of information, but the idea is the gut can correlate with everything from immune function, mood disorders, hormone balance, which we'll talk about when we do hormones, a lot of things. So we really, really, really want to have a nice, healthy GI tract, full bowel movements every day, no bloating after you eat, unless you overeat, and then it's your own fault. Make sure we're having no food particles in the stool, no greasy, fatty, floaty stool. That's not normal. We want to make sure that we're really healthy bowel population. Any questions? You can type it into the chat because I can't hear anything apparently. A few more minutes. Okay, if you have any questions and you think of something, we could type it and send it in an email to the info@salthealth.com, and then I can answer them before the next educational series lecture. Anybody have anything? You might be able to unmute yourself and ask if you need to. Nope. Okay, I know that was a lot of information. I hope you guys have a fantastic day today.